have the pleasure of working on Main 7 North, which is the psychiatric unit. We have exposure to all diagnoses. We have lots of schizophrenic, depression, borderline personality. The diagnosis can go on and on. But the biggest challenge is to watch some of our patients that are being entertained by voices, to have a music therapist on the unit, which has been a pleasure, to watch the patients get involved in music and the voices begin to stop, and to give them that power back, knowing that this is a distraction that they can use to help them with the voices. Some of the other experiences that we've had is to have patients that feel like they have no power, no coping skills, and if we ask them to give us some coping skills to remind us of some of the ones they've learned, they may have a difficult time. But we will have the music therapist to come in and have them to list some songs and come up with a playlist of songs that they can use when they're in times of distress. And they can just rattle off songs, and they can sometimes sing the words of those songs. And you can see people feel to be empowered. It's kind of neat to watch. I'll give you an example. We had one young lady, and it was the first time we did a really, really good co-treatment with our music therapist when she came on the unit. And I think it was coping skills, how they can use their coping skills. And she was in the group where she had to come up with coping skills that she's learned. And she wrote some of the words, and she was able to rap, and she got all the other patients into it as well. Well, before that young lady left, she realized that she needed to get back in school, that she had a music component herself. And she thought, well, maybe I should be a music therapist. And for some reason, I really do think that she's going to follow through with that and will do well. I can also think of a, not young man, but I call him young man. He was maybe in his 60s and 70s, who would have such nervous tics. And he couldn't stop the tics. He couldn't stop moving. He couldn't stop the jerking. But if you gave him an instrument and asked him to stand up and sing, you notice no jerking, no involuntary movement. It was just very planned. He would sing and just shake his instrument. So every time he come to group, he was beginning to think he was going to get an instrument, which was not always so. And my favorite is a very timid patient, quiet little church mouse, wouldn't talk to anybody. And one day, the music therapist came in, and we were going to write a song. And she got up and she started singing, and she sounded like a beautiful, beautiful songbird. And once everybody told her how well she sounded, she got her confidence back, and she decided that she wanted to lead the choir. She wanted to be the director. And we found out that is what she did back at her church. She was the music director. So once again, I will wrap it up by saying that along with OT and music, we on Main 7 North have empowered so many other patients that otherwise probably would have been empowered, but they got empowered a lot quicker by those co-treatments and by using music and letting them use themselves to help them to be better. And actually, the music therapist came up with this awesome studio, a recording studio, and we co-treat, and half of us would take the patients, and they will come up with song words and lyrics to go with the topic, whether it's stress management skills, coping skills, whether it's going to be sensory skills that they're going to use to help to regulate their moods. And the music therapist will take the other half of the patients, and they come up with the beats and the music. And what is so rewarding to watch is as the patients get the music and the words together, and they all sing, and they create these songs, and they're really nice songs. I think we have maybe about 15, what do they call them these days, CDs, that are really, really good. And I think some of them we can probably make some money on if we really wanted to. They sound really, really well, and it's really neat to watch the patients, music therapy, occupational therapy, work together and to help to get patients better.